right now we want to talk about safety. So the Ghana Chamber of Mines is organizing, the National Intermines First Aid Safety Competition. And this is essentially to bring to fore the need for safety precautions, especially at the mine site, but also how we can adopt these safety precautions to our own lives. I have in studio one person to help me and also one person to join us via Zoom. In studio is Mr. Alfred Eshifi Abeka. He is a first aider with St. John's Ambulance. You're welcome, sir. And also joining us via Zoom is Mr. Joe Stephen Annan. He's a senior manager, occupational health and safety, Anglo-Gold Ashanti Obuasi Mines. I'll let you know when he gets to join us. But Mr. Abeka, it's good to have you. Yeah. I know that in the mining industry, safety is a big deal because, of course, you have all these heavy machinery that you're working with, and so it works that way. But there are also tips there, especially first aid tips that applies to our everyday lives. Yeah. Let's start with those. As we wait for Mr. Annan to join us, let's start with those. Give us the very basic items when it comes to first aid. What are the very basic items that everybody should have in their first aid box?
First aid box. Okay. So my greetings to the viewers. When we talk about the first aid kits, we have to be very careful with the box itself. It should be an identifiable container or box, okay, that people can easily access. There are a lot of things that can go into it, but basically, everybody should have something like the bandages. We have what we call the roller bandages. So you need to get the roller bandages. It's used to secure dressing in place. In case of any fracture, you can use it. You also need to get gauze swab. Gauze swabs.
Gauze swab.
Gauze swabs.
Okay. Right.
You also need to get,
and why do you need that? You told us why we need bandages.
Yes, to control bleeding.
Okay.
To control bleeding. Yeah. Then you also need safety pins. Safety pin to lock or to tight the bandage in place when you use it over the dressing. You also need scissors because you might cut. There are a lot of cutting that you have to do. So scissors should also be in the first aid box. You also need to have assorted plasters, different shapes and different sizes. They also needed to control at least small cuts. You need a plaster to control it or to cover it. You also need something like tweezers, in case there is something that you need to pick from a wound.
Okay.
Yeah, you can use the tweezers to pick it. You also need, I think you have a notepad and pen.
Why do you need that?
Yeah, you need to do some recordings.
Okay.
If you want to do some recordings, maybe you've checked the person's temperature and you want to record it. Okay. You need the pen and the notepad, small notepad to write in it.
Okay.
Yeah, that's why you need it.
Okay.
There's some cases people would like to have some torchlight, small torchlight to assess maybe in the evening or to check maybe the dilation of the eyes. You can also get that one too. You need to get cleansing wipes. Cleansing wipes to clean around the wounds. You need to clean around the wounds. So cleansing wipes is very also important. It's very, very important. In this COVID area, if you have the aqua-based sanitizer in it, it's also good for you. Then we shouldn't forget the how do you call it? The disposable gloves. You need to protect your hands so that you will not infect yourself. So gloves are also important. But we recommend that you need to get latex-free gloves because some people are allergic to the latex, the natural latex. When they put on the gloves, they have some rashes or allergy. So latex-free gloves is recommended.
Okay.
For.
I see. So these are the things that you need to have in your first aid box. Yes. But usually there are painkillers, etc. Are those not necessary?
We don't recommend the painkillers.
Why not?
Yeah, because the issue is that your first aid kit is made available to everybody at the workplace, just like this place. It's made available for everybody. If you don't regulate it, someone can go in and pick the painkiller and take it. And you know, when you abuse it, it will create a problem for you. So the painkillers, we don't recommend it.
You don't recommend, but yes. What if the person is in pain? Doesn't mean that there's nothing that can be done in the moments that the accident or the incident occurs.
Okay, so we need to find out what really is the problem. Okay. What is the problem? Something has caused the pain. So we need to tackle that thing. If you're able to tackle it, then the next thing is that then the person is sick for medical solution.
I see. Let's move on to what processes you need to go through as a first aid. For example, when someone is choking, what are the processes you need to go through? Okay.
So when someone is choked, the first thing you need to do, and in fact, this is an advice to the general public. The first thing is that your safety.
And also to those in the mining. The mining sites.
Yeah,
okay.
The first thing is that your safety. You have to make sure the place is safe, for the scene is safe for you, for bystanders, and even the one who is injured. And make sure there's no obstacle that can also put you at risk. You also need to protect yourself, at least you have the gloves, put it on, so that when you touch the person, in case of anybody fluids or anything, you don't infect your hand.
Okay.
Now, the next thing is that you need to seek for consent. I want to help you. I know first aid. I can help you.
But if the person is choking, how will they be able to consent to you helping them? If they're choking, you just go ahead and help them, no?
Yes, but at least you need to draw the person's attention. That you are there to assist.
Okay.
So I want to help you. I know first aid. You know, with that one alone, you build confidence.
Okay.
The person allows you to do it. So then the next thing is that you ask, are you choked or are you choking? We do that to ascertain the severity of the choking. Because sometimes it could be mild, sometimes it could be severe. If it is mild, at least the person will be able to cough or the person will be able to talk. So you ask, are you choking? The person responds and realizes that it is mild.
Okay.
Then encourage the person to cough. If it is mild and the person coughs, the coughs will be able to dislodge the object out of the airway. If you also realize that it doesn't come out, it means that it is severe. Then if it's severe, the next thing you need to do is what we call give 5 back blows. You give 5 back blows. Now, it's
5 back what?
Blows.
Blows.
Yes.
So like you hit the person?
Yeah. So, yes, not like blow like we are fighting.
Okay.
You use the heel of your hand here. Then just at the back straps of the person, the shoulder blades in between. Then you give that blow there. And
the person will be able to cough out whatever is choking.
Yes, when you do that, the next thing is that you need to support the person on the abdomen. The person leans on your hand.
Then you hit the back.
Then you hit the back 5 times.
Okay.
Just like this, 5 times. Now, it's expected that within this period, that 5 strokes or blows, the object should be able to dislodge. Now, if it's dislodged, you need to check from the mouth that clearly it's dislodged. If it's dislodged, then that's it.
The person is okay.
That's okay. But if it's not dislodged, then there's another thing for you to do, which we call the abdominal thrust.
Okay.
Abdominal thrust. And this is how we do it. Let your two arms go around the waist of the person.
Which is what we're showing on TV right now.
Yes,
like this?
Like this. Like this. But it's important the person at least bends a little bit.
Okay.
So your fist, you place a fist in between the navel and the bottom of the sternum. Then you clench with the other hand. Then you scoop, you move it inward, sharply inward, upward, in the scooping mood. In the scooping mood. When you do that, it will help the person to bring the thing out.
Okay.
Then the person will be fine. Now, for you to be sure that the thing it's out of it, you need to check from the mouth that it's out. Check the mouth and find out that it's truly out. So we've spoken about encourage coughing. That is if it is mild. If it is severe, then you need to give what you call the 5 back blows. Using the heels of your hand. 5 back blows. If yes, if yes, like
just
this.
Like this.
Just like this.
Okay.
Just like this. If it doesn't, the object does not dislodge, then you do what you call the abdominal thrust.
Okay.
Abdominal thrust. This is why I said between the in between the navel and the bottom of the sternum. You
right.
put
So
it there.
at this moment, this person is dealing with a child.
Yes.
Is there a difference between how you have to handle an older person and how you have to manage a child?
Yeah, for a child, like someone from a year to 7 years, then an adult from 8 years to whatever age, same. It's done same.
Okay.
Unless it's an infant, less than a year, an infant, it's quite different. It's quite different.
That one you may have to take them to the hospital, I guess.
No, what you need to do is that...
something.
Yes, what you need to do is that turn the baby face down on your thigh.
Okay.
Then support the head. You support the head. Then the back blow should be given to the baby.
Softly, I guess.
Softly. You need to check the blow.
Okay.
The weight of the blow. 5 times. So as you do the 5 times, it's expected that the thing should come out.
Okay.
Now, at the end of the 5 times, turn the person upwards on the other thigh. Check the mouth if the thing has cleared.
Okay.
If it has not cleared, then you need to do what you call the chest thrust. Then you put, it means that you need to put the tip of your 2 fingers on below the nipple line.
Okay.
Then you push it inward, upward, towards the neck region.
This is for the child?
For the child, for the infant.
Infants.
For the infant.
Okay.
As you keep on doing this, that's what we call the chest thrust. As you keep on doing this, the object will come out. Now, if it comes out, check the mouth. If you see it, you pick it.
Okay.
Pick it out.
I see.
Then you are fine.
Okay. Well, Mr. Joe Steve Annan is Manager of Occupational Health and Safety, Anglo-Gold Ashanti Obuasi Mine. He's joining us via Zoom. Mr. Annan, thank you for your time. Good afternoon. It looks like you're muted.
Sorry, yeah.
Yes, I do hear you now. So we started the conversation before you came in, and I wanted you to, educate our viewers a little bit about this Safety Week program that you're observing, even before we go into the concept of first aid and how safety is related. I know that in the mining sector, safety is a big deal for you. So why is this particular week or exercise, this program, so important?
Yeah, it is important. It's something that we've been doing. Prior to the onset of the COVID, we were actually doing face-to-face, hands-on, practical, on the field and assessing people, and also educating our host communities or the communities in which we operate as well. So we realized that some of the teams, we even have community teams, and also the students whom we educate on health, safety, environmental protocols, and that kind of thing. However, because of the COVID this time, we decided to change it a bit, of course, as we all know, to minimize potential cross-infection and that kind of thing, and do it in this form through the social media, through TV stations, by educating the public. And also, it's a good way of reaching out to others in the nation as well, as far as the education is concerned. So it's something we do, it's annual. We do it per zonal. We divide ourselves into 3 zones and then come up with the nationals, which is hosted by the respective mining companies.
Okay.
And it helps us to build that as well, right?
Okay, so we're talking to you from the Anglo-Gold Ashanti, and you're expected to share your own safety experience with us so that we can, sort of apply it to our lives in general, I believe. But then, if I may ask, is this a competition? Does it mean that the companies compete on whose safety protocols superior to the other? Is that what it is?
Yeah, this is a competition that we do.
Okay.
What we are doing now is not a competition. Maybe I should put that straight.
Right.
Yeah, we've been doing it competitively. Competitively because it brings a drive, for people to at least do what is expected of them. And but the import is to ensure that we are keeping ourselves abreast. And also the competition is not just between the companies or among the operating companies. The most important thing is that we use this as an opportunity to form teams within our communities. So each mine operating in every community has a community team as well. By so doing, we use this opportunity to educate our community members about how to protect themselves, whilst doing things the way you need to think about it, assessing the risk, putting in place controls before you even start it, irrespective of whatever level, whether at small level or high level. At national level, we can talk about big things. At our community level, we talk about how we live within our own community, lifestyle issues, and basic first aid, as my brother might have already explained. We also have a program where we also have education, like the students from educational units or classrooms involved in this. We educate them. They also compete among the respective schools within our host communities. And of course, we give them award to motivate them. And by doing this, we keep our communities abreast with health and safety. And they even help, so that in case of anything that happens in the community and we need support, they are the same people we fall on. So we see the community as ourselves, and we see ourselves as the communities in which we operate.
Okay, so that's very good education for us. So for people who are watching us, who are within your host communities and other host communities of other organizations, let's try and help them understand. If we talk about the relationship between first aid, and we've been talking about first aid here with Mr. Becker, the relationship between first aid and general, safety mindset. Help us break it down so those who are also watching who are not miners can still learn from the mining experience of safety.
Okay, so I would put it that if you talk about health and safety in broad sense, there are different disciplines that come in. So first aid attendance, for instance, comes in when somebody is injured or when somebody is hurt, or if we have to put in systems to prevent injury or mitigate injuries. But let me give you a scenario. Assuming you have a tank in your facility, whether in the mines, oil and gas, wherever, that you fill it with, let's say, flammable liquid, let's say petrol, right? And then in filling the tank, should the tank overflow and the petrol comes out, it will catch fire, it will explode, and the communities around will be impacted, etc. So people will get injured. Workers, some may die, some may get injured. But safety comes in to say that, okay, in designing this tank, let's put in a certain sensor somewhere, such that if you fill the tank and it gets to that level, in order for it to overflow, it gives you an alarm for somebody to stop the pump that is feeding the tank.
Okay.
That is a safety control. Now, another safety control can come in and say, let's put in another level where we have what we call high level sensor. So as you fill this tank, and then even if it gets to first level sensor and the person who has to hear didn't hear it and it gets to the second level sensor, it is synchronized to the feed pump and it will cut the pump automatically. So the feed will not go in for it to overflow. These are safety controls. But should it overflow and then it explodes and people get injured, you have people on site, first aid, emergency response team, emergency physician, etc., who will attend to in case somebody gets injured. So when you talk about safety, it stems from engineering design stage, construction stage, operation stage, and then the medical stage. Then even while the worker attending to the tank or filling it and cleaning it and that kind of thing, people get into it, get exposed to volatile organic vapors and that kind of thing. And there are people we call hygienists who also put instruments on workers, monitor their exposures and that kind of thing to ensure that we are not overexposing our workers, to toxic gases. So when you talk about health and safety so broad, the first aid is an aspect of it. There is engineering aspect, there is hygiene aspect, there is system aspect. It's so broad. So that is how it is.
It's broad indeed, and we won't have all the time to talk about. So I'm wrapping up this conversation, but I want you to, let's try and bring this home to those of us who are not, because it sounds very rigorous. It sounds like a very rigorous safety system. So by so doing, you are looking at minimizing accidents, and even if they happen, you have a plan for it. How can individuals, for example, be helped to develop the needed consciousness for health and safety? Because we don't work in the mining areas. But as you are looking at your safety protocols educate us on how we can develop that mindset of safety generally.
Yeah, so it's simple. So through education, through sensitization, like what we are doing right now, it's part of it by reaching out to people through posters, through communication, through meetings, through programs like the first aid competitions that we do, within our communities. And then there are other opportunities for improvement that probably people like yourselves and the nation can take over. For instance, you can have a program on your TV or radio, having, let's say, weekly, maybe safety corner, inviting people from the safety fraternity to educate people. There are very basic, simple things like our homes. Somebody builds a house, he has a staircase from ground floor to up floor, and then the rails are good. And a child is trying to descend, he goes through the rail and falls, you lose a child, or your child gets injured. There are some very basic, fundamental stuff that I think through education, through public campaign, and through also what we write up and publish out there. People need to read, people need to attend to signs. There are very basic things that we don't pay attention to. But I think through this education, people pay attention to them. Simple things like road signs. You see people driving, the sign is telling you to do one thing and they ignore and do another thing. So first of all, we need to educate people and also put in measures. People who repeatedly deviate from compliance, you can talk about DVLA and all those people. There has to be some punitive measures to them as well. But most importantly, let's educate our people. And we need everybody on board, including yourselves.
Right. It has to start from the individual level. Certainly, exactly. and this is an ongoing, observation of the Safety Week. So I understand it's ending on 25th. There'll be more time to talk more about this, Mr. Annan. Yeah. But I'll say a very big thanks to you for joining us in this conversation. Let me take your final words here in the studio, Mr. Abeka. I had other things that I wanted to ask you, but I've run out of time, unfortunately. Okay. But dealing with burns, dog bites, snake bites, if you can wrap it up for me with that briefly.
Okay. So if someone is burned, or it could be from hot water or naked fire, iron, all what you need to do is to cool the burn with cold water. Okay. I don't mean the one in the fridge, but the normal tap water. Okay. Cool it for at least 10 minutes or until the pain is relieved, which means that the person will tell you, after it's cooled, the next thing you need to do is if you get a clean film or non-fluffy dressing, then you dress it, then take the person to the hospital. Because with burns, infections is one of the key things that we have to be careful with. Then in that one, to be careful with your safety. You're the one to offer the first aid. Yeah. Be careful with your safety. When you talk about dog bites, what you can also do is that we use soap and warm water to wash the area. Then you pat dry. Cover it with dressing, like the gauze, and you secure it. Yes, then take the person to the hospital, seek medical advice in case of anything. Sometimes it could be deep bleeding, deep cut from the dog or bite from the dog, whether we're bleeding, then you need to control bleeding. Take the person to the hospital.
Okay. Sounds like a first aid 101, but very good learnings for me here. But like I said, between now and 25th, there'll still be a lot or more of these conversations here on JoyNews. You want to stick and stay. This is brought to you by the Ghana Chamber of Mines, and they are doing the National Intermines First Aid Safety Competition. They're unable to do it, the way they would have done it without COVID. So they're doing through traditional and social media to reach out to you. I've been doing this with Joel Steve Annan, who is a manager, occupational health and safety for Anglo Gold Ashanti, the Obuasi mines. Thank you very much, and our regards to those in Obuasi as well, Mr. Annan. And I also had here in studio Mr. Alfred Eshwifi Abeka, First Aider, St. John Ambulance. Thank you very much for coming once again.